happen. And I had the good fortune to meet Brooke and Dr. John. These guys are on here tonight, and I just want to acknowledge them. One, they are just incredible individuals, and I'm going to bring them up on spotlight for all of you guys to get a chance to meet both Brooke and Dr. John. And I want you guys, number one, I'm just going to ask them a couple questions. Just some great leaders, and a lot of what Larry talked about today, I believe this couple really encompasses. So first of which, Dr. John, Brooke, thank you guys for what you're out there doing. They're brand new. I don't even think you're 2 weeks into business. And in that very short period of time, they put together some Zoom meetings that I've had the good pleasure of getting the chance to sit in on, and just did amazing. So Brooke and Dr. John, number one, why don't you guys introduce yourself? This is our leadership organization, and then maybe you could talk about how many people you had at your last two Zooms in literally the last 3 or 4 days. And we'll let ladies first, and then Dr. John, we'll throw it over to you, and you can also talk about Impact Health and what you see this product doing for medical professionals and patients around the country.
Wow, we are so honored and just blessed to have been picked up the phone and made that first Zoom call with our sponsor. She thought enough of us to give us a call and see if this might be something that would interest us. And as it would seem, we're very successful. I have a great real estate business. My husband's a physician. We might not look like we would be open to anything, but you never know what somebody's really got going on. There are struggles all over the place. And I have a desire to help people and to expand to a more residual type income, because the last year was rough. It's not fun to have a reduction of your salary by half, and that's pretty much what happened in 23. And so this will allow a more stable income for the future. But we got busy and we invited folks, and we know enough that we needed to invite everybody. Don't prejudge, just invite everybody. And that's what we did. And I think we've had several Zoom calls with, maybe 15, 20 people, maybe a few more. Huh, John?
Yeah, I think so. Yeah, we've had, been impressive. Thank you, Brooke.
But we also had a wonderful time coming to just meet people and get to experience the whole environment around ACN. It seems to me that this is the type of organization that kingdom principles really shine. Servant heart, and you reap what you sow, and just be faithful in it, and continue, and you're going to be blessed, and bless other people, more importantly.
But Brooke, first of which, congratulations. I know you work with Mike Bryce, and there's a number of great leaders you're plugging into. They had over 28 people at their first Zoom meeting. They had over 20 people at their second Zoom meeting, and they did not prejudge. I mean, they truly invited everybody to come take a look. And I believe in Dr. John, maybe you can tell everybody from a medical perspective how big you think impact will be for the American public, just based on your level of experience in medicine, and also you being on a share, both you and Brooke, for many years, meaning as a medical professional. I'd love for you just to put a little light on that for all of us listening here today.
Yeah. Thank you, Patrick. I appreciate it. So I'm just, I'm honored to be here. Like Brooke said, she's a real estate agent. I've been a medical doctor here in Mississippi for 25 years, and ER doctor, general practitioner. And COVID, has been rough. And I no longer work for the hospital. And so Brooke and I, we're faith filled. I feel like, I just, my main purpose in life really is to help others. And so that's what I've really tried to do in the last few years through COVID. And, I was literally praying, just trying to figure out, what direction to go next. And I didn't want to go back into a hospital setting. But financially, that's I've taken quite a substantial decrease in pay, being in private practice, and so just praying, how what to do. And so Jane, our sponsor, called us. We met Jane down in Florida a few, I guess, about a year ago, and she's a prayer warrior. We did a lot of praying together, and when she told me about this, I didn't really care what it was. If Jane said it was something to look at, I was willing to look. And when I saw it, Mike Tyson or Mike Bryson and Patrick Mays are there. They showed me this program, and I just thought it was good. Impact sharing. Brooke and I have been on Christian Share, Meta Share for probably a decade or so. And, for me, we're generally healthy folks, but we wanted kind of a catastrophic plan in case we had to go in the hospital setting, we could use it. And so impact health sharing is similar to that, but it's much better. And so I just got excited about it. I think it's, it's going to revolutionize the healthcare industry, and that people are getting doctors are moving away from the hospital setting, setting up private practice, and this they're getting away from these big insurance programs like Blue Cross Blue Shield, because they want to have freedom too. Just like patients want to have freedom to choose what doctor they want to go to, these doctors want the freedom to be able to practice medicine the way they know to help the patient. And, these big healthcare insurance companies, many of them are very much uh, tied to big pharma. Just like the COVID vaccines, for example. I mean, pretty soon, if you're, say, a Blue Cross Blue Shield member, uh, you're going to have to be fully vaccinated to keep that insurance, and the doctor is going to have to push the vaccines or any pharmaceutical, whatever the insurance company wants them to push. So I see this as a breakthrough. It's going to revolutionize and help the whole medical freedom movement, and really help create a new parallel healthcare system that's going to replace the old broken healthcare system. I'm excited about it. Yeah. So
Wow.
thank you a lot, Patrick.
Well, first of which, thank you guys, number one, for your example. You know what I mean? Not prejudging, picking up the phone, putting people on a Zoom call, allowing for them to see what you and I have been able to see together, and then being able to share that blessing with other people. And look, some are going to say yes and some are going to say no, but having that courage to pick up that phone and give them a call, you're going to see a lot of these too. They are on the fast track of helping a lot of people, and just appreciate what you said. But how many of us got a lot of confidence just hearing from Dr. John talking about, here's the way we feel as a medical practitioner, and us being able to have freedom to be able to treat the patient and not being dictated by a big corporation on the way that we're going to treat the end consumer. So does everybody understand how big of a blessing we have and what we can do, what 180 of us can do? You know what I mean? Sometimes we look around and think, well, what can we do? We can do a lot if we're all in agreement and we're all moving in the same direction and we're all in one accord. And that's what you're seeing here with this couple and many other people that represent what they do here as well. But can we give them a round of applause? Thank you guys both. We're so appreciative that we have an opportunity to work together, and looking forward to continuing to help the masses together as an organization. And so with that being said, number one, I believe, the timing is never going to be better than it is right now. It is